Hello, I'm Dr. Rita Pickler, the Flo Ann Sowers Easton Professor of Child and Adolescent Health in the Martha S. Pitzer Center for Women, Children, and Youth in the College of Nursing at The Ohio State University. I have over 30 years of experience in patient-oriented research with a focus on the care of preterm infants and their families. I have been funded continuously by the National Institutes of Health for over 20 of those years, including 2 randomized clinical trials testing interventions to improve developmental outcomes through the use of patterned caregiving experiences. Although I am working on a number of research projects, what is most important to me is the care provided to preterm infants in the neonatal intensive care unit. I believe strongly that this care should be family-centered and focused on treating infants in ways that are most important to support the developing brain and human interactive systems. In other words, I'm always looking for ways that encourage us to treat, view, handle, and touch these small, fragile beings in ways that are most supportive of normal environment. Most of my work has been done with research teams involving nurses, physicians, engineers, and psychologists. These teams have collectively discovered that infants learn and develop with each and every caregiving experience. Thus, we have developed a number of caregiving interventions that take advantage of what we know about infant development, supporting age and health capabilities to produce the best outcomes possible. Although sophisticated hospital care is critical to preterm infant survival, these infants are first and foremost human babies, and thus they need to be touched, spoken to, handled, and cared for in ways that are appropriate for babies. Based on what I know scientifically, it is important that we manage the care of these infants in ways that are designed to promote the best possible health and developmental outcomes. And of course, parents are critical to that care, and so we must also focus on being sure we have removed barriers to parental presence in the NICU and participation in their infant's care. What's next for me is in fact a study examining barriers and facilitators to parental presence and participation, and also examining the effect of that presence and participation on clinical and developmental outcomes. In an ideal world, infants would not be born preterm, but they are, at a rate of about 10% in the US and an even higher rate for some racial and ethnic groups. And so until we can eliminate prematurity, we must be committed to providing the best possible care for these infants and their families.